Today, we're diving into a really revolutionary shift in how we fight cancer. We're going to be talking about moving beyond our DNA code itself and looking at the very systems that control it. You know, the whole story really starts with this one incredibly powerful question. It's a total change in thinking, and it's opening up completely new ways to think about treatment. So, to really appreciate this new approach, you first have to understand the core challenge. I mean, cancer is a disease of our own cells, right? They've just gone wrong. And that makes attacking it, well, it makes it incredibly difficult to do without harming the rest of the body. Think about it this way. Early therapies, like chemotherapy, were designed to kill any cell that was dividing rapidly. Now, that's great for cancer cells for sure, but it also hits healthy, rapidly dividing cells. You know, in our hair, our stomach, our immune system. This collateral damage, what scientists call off-target effects, that's the reason behind so many of the harsh side effects. We just needed a smarter weapon. And that is where the breakthrough comes in. Scientists started to realize that cancer isn't just about mutations in our genes, but it's also about the instructions that control those genes. And this is the whole field of epigenetics. I love this analogy. It's just perfect. Every single cell in your body has the exact same cookbook, the same DNA. But a skin cell, well, it uses different recipes than a heart cell, right? Epigenetics are those little sticky notes and highlights that tell a cell which genes to turn on and which to just leave off. The problem is, in cancer, these markings get all scrambled up. They start telling the cell to use all the wrong recipes, and that's what leads to that uncontrolled growth. Okay, so what's really cool about this image is how it shows you that control layer. You can literally see how that epigenetic influence is just layered right on top of the DNA itself. When this system is working the way it should, you've got a healthy cell. But when it's disrupted, when the wrong genes get switched on or off, you get a diseased cell. But here's the crucial point. These epigenetic marks are reversible. And that reversibility, that's the key to everything. It means we could potentially fix the faulty instructions without having to rewrite the entire DNA cookbook. This one insight, well, it builds a whole new strategy for therapy. This visual just illustrates that shift perfectly. Up top, you see the old way. It targeted the global epigenetic machinery, so it was affecting genes all across the genome. Yeah, the problem gene, but also a ton of innocent bystanders. It was still kind of a sledgehammer. But the new precision therapies, what you see on the bottom, they aim to change the epigenetic state of only the specific gene that's driving the cancer. That is the scalpel. So, to put it really simply, we've moved from this broad spectrum approach with a super high risk of collateral damage to a highly targeted one. The whole goal of precision therapies is to get the maximum benefit from the treatment while, and this is key, preserving healthy cells. That is a total game changer for patients. Now, this new understanding didn't just stay in a lab somewhere. It's actually led to the development of completely new classes of drugs, all designed to rewrite those faulty epigenetic marks. This slide gives us a fantastic roadmap of how these drugs have developed. You can see a really clear evolution here, right? From the first generation all the way to these more refined and highly specific third-generation inhibitors. Okay, so let's break them down. All right, so the first wave included drugs called DNMT and HDAC inhibitors. Now, don't worry about the names, just think of them as the pioneers. They've been FDA approved, and they're now standard treatments for certain blood cancers like MDS and AML. And in those diseases, they've shown really clear benefits. Then the next generations got even smarter. We started seeing more refined versions of those original drugs, but also brand new classes of inhibitors. The key thing to take away here is that these are designed with incredible specificity. They target the unique epigenetic machinery that's broken in one particular type of cancer, and sometimes they're even linked to a specific genetic mutation. But this is where the story takes a really fascinating turn. It turns out the biggest impact of these drugs might not be when they're used alone. We're talking about more than just adding a new weapon. It's a huge shift away from looking for one single silver bullet and moving towards a more holistic, systems-based approach to cancer therapy. And this new philosophy is captured perfectly right here. An epigenetic therapy can act like a primer, making a tumor that was totally resistant to treatment suddenly vulnerable again. So we're not just trying to kill the cancer cell anymore. We're trying to outsmart it, reprogramming its defenses to make our entire arsenal of treatments work better. So let's look at the three main strategies this opens up. First, these drugs can make chemotherapy work again by reversing the epigenetic changes that tumors use to become resistant. Second, they can stop cancer cells from finding new ways to survive targeted therapies. And third, and this is so cool, they can supercharge immunotherapy by essentially unmasking the tumor, helping your body's own immune system see it and attack it more effectively. Okay, so with all of this incredible promise, it's really important to take a clear-eyed look at where we are today. The field has come an incredibly long way, but there are still some pretty significant hurdles to overcome. This table gives us a really balanced summary. So on the success side, we've got FDA approvals, proven benefits, especially in blood cancers. That's huge. But on the limitations side, their effect as a standalone therapy in solid tumors, it's been pretty modest. We still have issues with toxicities, tumors can still figure out how to resist them, and a lot of the drugs have to be given by IV. So the bottom line is we're not quite there yet. But the good news is researchers are actively working on all these challenges. The future is really focused on creating even more selective drugs, using things like liquid biopsies to monitor a tumor's epigenetic changes in real time, and developing targeted delivery systems like nanoparticles to get the drug right to the tumor and slash those side effects. And really, this quote just captures the whole essence of this field. While our DNA provides the blueprint, it's this dynamic, editable language of epigenetics that might just hold the key to more precise, more personalized, and more effective cancer treatments for years to come.